Hi, everyone. Thank you so much for joining us today. I'm Madison Mills, a journalist at Bloomberg News, and today we are talking about masks and masculinity. Men are more likely to get COVID-19, but they're also less likely to wear masks, and that's according to a new study by Valerio Capraro, who's joining us today. We're also joined by Liz Plank, an author and feminist icon, who is going to talk with us about men and masculinity. Thank you both so much for making the time. We're so lucky to have both of you here. And I also want to remind our audience that if you're watching and you have any questions that we're not covering, this is a conversation for all of us. So please comment with any of your questions that we're not hitting, and we will be reading your comments and get to as many as we can. But Valerio, I'd love to start with you. Can you just give our audience an overview of your findings?
Yes, absolutely. First of all, thank you a lot, Madison, for the invitation, and sorry for my Italian accent. So in this study, we collected data in the US from 2,500 people, and we looked at intentions to wear a face mask in 3 different scenarios. So, every time when engaged in physical activities, essential physical activities, and when around people outside from their household. And as a first result, we found that men are less likely than women to report that they intend to wear a face covering. But then in the second part of the study, we also tried to look at the reasons why there is this gender difference. And we found some interesting results. So we asked people whether they agree or disagree with some statements. And the statements were, wearing a face covering is not cool, wearing a face covering is shameful, and wearing a face covering is a sign of weakness. And we found that men more than women agree with these statements. So apparently it seems that part of the reasons why men less than women intend to wear a face mask is because they think it's a sign of weakness. And this was one result. Another result that we found interesting is that men more than women think that they will be unaffected by the COVID-19. And this also explains why less than women intend to wear a face covering. And if you think about this, it's a bit ironic, if I can say this word, because actually from statistics, we know that men are more likely than women to get COVID-19 and to die of COVID-19.
Absolutely. And Liz, can you tell us your thoughts on that and some of your research on men and masculinity and why mask wearing might make them feel weak or not cool, as Valerio mentioned?
Yeah, I mean, I wrote a book called For the Love of Men, A Vision for Mindful Masculinity, that came out in September of 2019. And I intentionally started that book writing that our current version or current definition of masculinity was the greatest threat to humankind. And I got a lot of pushback for that. I got some praise, some people were like, yeah, but a lot of people were like, that's a little much, like you are exaggerating. And I obviously spent 376, I think, pages of the book trying to defend and prove that thesis through a wide variety of studies that amazing academics like Valerio have been doing on this topic, and in so many different industries, and so many, it goes beyond health and it goes into so many other spheres of our lives and men's lives. But what I found is that this thesis has become so much more relevant and unfortunately true in the era of this global pandemic that we've been all going through over the last few months. So I was really excited, and I told Valerio when we were in the green room how excited I was that he conducted the study. I think it's extremely important that we do study masculinity. As a person who was a women's studies major, was a gender policy. I did a master's and graduate degree in that field, and ended up realizing that I'd never really had a class about masculinity and never really been assigned a book about masculinity, and how unfortunate that is, not just for, I think, the study of gender and, realizing that everyone has a gender, and that in the same way that women are affected by what they see on TV, the roles that are available to them in society, the same thing happens for men and boys. Men and boys become who we think men and boys become who they think they're supposed to be. And so we're seeing this play out in terms of the coronavirus, in terms of, and it's really unfortunate because we see it play out with the coronavirus, right? As Valerio stated, more likely to die from the coronavirus, more likely not to wear protection and to take the necessary precautions not to die. So women who are less likely to die are more likely to basically do the right thing. We see that in the book as a lifeguard. I remember being in a lifeguard class in one of the trainings, and casually it was brought up that 80% of drowning victims are male. And I remember just kind of pausing in my tracks and raising my hand and being like, wait, what? Like, why? Are men just worse swimmers? Like, is there something in their genitalia that like drags them down? Like, what is going on here? So it's not right. There's no biological difference between the swimming abilities of male or like men and women. Men and women have equal swimming abilities. Men are far more likely not to wear life jackets. Men are far more likely to go on a boat or to engage in aquatic activities when they're under the influence of drugs or alcohol. So they're more, right? They think that they're less likely to end up in an accident and therefore will take more risks. So that's just one of the examples. Men are less likely to wear sunscreen, more likely to die from skin cancer, despite having the same skin as women. There are so many different, areas of especially men's health that I think need this conversation. And I'm, disheartened by the data that Valerio and many other, researchers have found. But I also hope that this can be a point of, rethinking, like, wow, this is what it means to be a man. Like, being a man means like, it is not cool to live. Like, it is not, is like gay, right? Like, and gay in a homophobic, right? We know that is tied to, our definition of masculinity, that it is like gay to live, So let's talk about that. And I hope that this is what this moment can lead to.
Absolutely. And both of you mentioned this idea of sort of a lack of risk aversion among men. Valerio, your study touched on that a lot. This idea that it's not just that men maybe don't want to wear a mask because of the way it makes them perceived, but also that they believe that they're more impervious to the virus. And both of you mentioned in the green room this idea that previous pandemics have had these risk aversion issues come up. So I'm wondering if you can compare what's happening now to other global health emergencies and how men have handled those experiences as well.
Okay, Liz, first of all, let me tell you that you touched a great point. And about risk aversion, I know quite well the point of view of economists and social scientists, and it is well known that men tend to be more risk-seeking than women. It comes out every time you do an experiment, even with small games and small economic consequences. But of course, we see this every time in real life. On YouTube, there are a lot of these videos of men doing super weird things. And
do you know about Jackass? Do you know the show Jackass? Is it played? Do you know that show? It was just a show where it went on for several seasons in early 2000, and men just did the most dangerous things in the world. Anyway, keep going.
Yeah. That's right. I think I saw something. But yeah, so it's totally true, and it's dangerous also for other people, because, for example, if you are not risk averse, you don't wear a face covering because you understate the probability that you get COVID-19, or you don't practice social distancing. If we want to talk about other pandemics, maybe you don't use a condom during a sexual intercourse. So you can have all these problems that clearly promote the spread of a virus, whatever that is. Yes, there is this huge problem that men are less risk averse than women, but one question is why? Why are men more risk-taking than women? I don't know, Liz, if you have reason about this. I'm really looking forward to hear your perspective.
Well, oh, sorry, were you done, or were you going to go into?
Yes, I'm done. My question that I don't know very well how to answer is why are men more risk-taking than women? Is there a reason? Maybe evolutionary or patriarchy? I don't know.
Yeah, so I mean, from the research so I talk a lot about risk in the book, and it is actually one of the most interesting parts of the research that I came across, which was, yes, men are take far more risk than women overall. So many examples of that in our society, right? But there's actually something called so there's researchers that actually looked into the data and parsed out the race of men who are averse, their documented status, so whether they're immigrant, the sort of male risk effect was actually a white male risk effect. So white men take so many more risks than Black men, than immigrant men, than Latino men, than indigenous men, that it kind of skews the entire gender, and actually makes us think that all men, regardless of who they are, how they identify in the world, take more risks than women. And so what we find is that, yeah, it is, and it basically intersects with privilege, right? And being, white versus Black or brown in American society, as we know, and as we've seen recently, and having well-documented data for, is a very different experience in the world, right? And so that to me is really interesting, right? And risk, as you said, is subjective, right? How, the amount of risk that I weigh that I could get the coronavirus is subjective to me. And the amount of risk that you weigh every day, thinking about, should I wash my hands? Should I go see this person? Should I be in this car? Should I stay at home? Like, your way, it's subjective. And I think that when we raise men in a society in a certain way, with a lot of privilege, right? With a lot of, unfortunately, sometimes entitlement, it makes them think that they are more invincible than they actually are, right? Or that they are entitled to doing certain things in society, and other people wear masks, but I don't have to wear a mask. And so that actually puts them in danger, and it puts other people in danger too. And so, yeah, I think risk is a really fascinating thing. And the last thing I'll say, this is my favorite study about risk that sort of exemplifies how it's all subjective. When they asked white men particularly about their risk, like, white men basically are more risk averse depending on what you ask them, right? So in one particular study, they asked them, are you risk averse, when it comes to taxing the rich, taxing corporations more heavily, more environmental guidelines, right? When it came to those things in which white men are going to be more affected by those laws, right? If we tax, the 1%, a lot of those people are white men. In American society, I'm sure in Italy it would, similarly be the same. The same goes with big environmental changes, right? That, those are things that women, that people of color, there's a lot less risk for them. There's much more of a reward for them. And so, again, even the way that we talk about, I'm so getting away from the coronavirus, and I'm so sorry, but the way that we talk about risk and what is a risk is also through often the lens of a white man, right? So it's a super fascinating topic. And then there's also testosterone, right? Which is men produce more testosterone. That's just like a biological fact. And testosterone makes you more competitive and makes you want to basically have more status. But how we define that status, right? What is a man that's on top of the hierarchy versus a man that's below the hierarchy is what matters. So if we have a president, for example, that says being a man on top of the hierarchy is not wearing a mask, doing, taking risks by putting thousands of people inside of stadium, and going to, as the Vice President Pence went to a choir where all these people are singing without masks near each other. That's what being the man, that's the man, then that is rewarded, and that is what men will seek to do. That's where you get it's not cool, right? What is cool, Valerio? How do you measure what is cool? It's a completely subjective assessment. And so we have to change what's cool, right? We need different social norms, and we need to raise boys to decide what's cool for them, not what's cool, by the society standards, which, ultimately endangers them when they do what's cool.
Absolutely. Yeah. Go ahead, Valerio. Yeah. What are your thoughts on that?
No, that's a good point, Liz. Just I would like to add something about gender differences in testosterone, because they highlight the fact that there are also some gender differences that are biological.
Yeah.
And probably, I think you agree with me that these are partly due to the asymmetry on the cost of reproductions. Reproduction is very costly for women, but it's very little costly for men. So the men in the market, in the mating market, it's called this way, women are the precious resource that men has to compete for. And this brings competition among men high. But I totally agree with your point that then what is rewarded is the key point. So if we manage to change the society in such a way that what is rewarded is something that is good for the society, for women in particular, but also for men, for the society at large, that would be a revolution.
Yes, pure social masculinity, right? And when you think about it, women, so this is one of also my favorite data points. It has nothing, it kind of has to do with this, narcissism, right? We know 80% or something like that, right, of narcissists are men. Why is that? Is there something genetic? And I went digging. I was really curious. I was like, oh, there must be something in the brain and the whatever. There's nothing biological. Basically, there's the same amount of narcissists that are born that are female and that are male. Like, it's pretty much like equal. But it's not rewarded for women to not have empathy and to not show empathy. It is not rewarded for women to be selfish, right? Women have to actually show a lot of selflessness. Women have to people, right? Like, there's all, women coming in and being extremely confident is seen as arrogant. It doesn't get as rewarded. And when we think about what gets rewarded for men, it comes back to that status seeking, right? The coolest guy in the room is the guy without the mask, is the guy who's extremely confident, the guy who might not have empathy, who's, measuring, sort of has a way of going about things that doesn't necessarily take others into consideration. Those are the men that we value. And so women are actually, there's a lot of women narcissists who basically lose that, personality disorder, or it becomes a lot less, visible. And so what could it look like, if we didn't reward that with men, or if, again, we rewarded empathy and rewarded the same kinds of things that we reward with women, with men, or just that we let everyone be who they want to be, that we wouldn't have a certain amount of rules or, set arbitrary norms for one gender and then a complete other set for the other based on, nothing. So anyway, sorry, I keep getting off track because I'm excited to have Valerio in the room.
No, but that's great. It's super interesting. I totally agree with everything you said. And this study you just mentioned is super fascinating. I didn't know about it.
It's crazy.
Yeah.
It's wild.
And Liz, both of you are bringing up such impeccable points. But Liz, you mentioned intersectional identities, right? And the importance of saying that, we're talking about white men when we're talking about a lot of these things. Valerio, I'm wondering if you can talk through some demographic differences you might have seen in your study and how mask aversion might differ between folks of different races.
Yeah, actually, to be honest, in terms of race, we found very little. I must say that our sample is a bit skewed towards the whites. So we have whites are overrepresented, but we still have about 30% of Asians and blacks, and also multiracials. But we didn't see major differences in terms of race.
It's interesting, if I can add, that might also be because of social reasons, right? So Black men in America, there's well-documented instances in this particular virus or in this particular pandemic where Black men who were wearing masks were thrown out of stores for wearing masks, right? Or even coming into a store wearing a mask, they were harassed. There was one guy who was like I think he was working at Walmart, putting like something in a truck, like doing, changes in the back. And he was, stopped by the police because, and again, he was wearing a mask and they're like, what are you doing? What are you stealing something? So there's real, racial biases, obviously that operate in American society when it comes to men and face coverings. And so what, your data didn't show a difference. And that might be part of it, that Black men are weighing it in their heads. They're like, well, I know I should be wearing this mask, but like, am I going to get stopped by the cops for being at Walmart and, like just doing my job? And so that might be, playing into it. And also we've seen the police do far more stops in terms of violations of social distancing for Black and brown communities than white people. So we've just seen more, sort of a policing, literally, that might also play into that. So, that's something we should remember as well.
Amazing point, Liz. Absolutely. Valerio, did you have a response to that?
No, I totally agree with the point. Unfortunately, our data cannot answer this point. But yes, I agree that can be like this. Absolutely.
Can I ask Valerio a question too?
Yeah.
Curious, like what if you could do a follow-up research, and maybe you are on this topic, what would it be like? Or has it made you think about other, things you want to study in terms of health and masculinity?
Okay, one thing I wanted to do, and we also have some partial results, is how can we convince people to wear a face mask through appeals or messages that can be displayed on posters or screens or voiced on the street. And we have some results, but okay, one thing that we know it works quite well is to tell people that the coronavirus is a threat to their community rather than a threat in general. So people react to the community. But in this case, we did not find any gender difference. So this message increases intentions to wear a face mask, both for men and for women. And another result which we found is to prime people to focus on their reasoning. So it's very simple. We tell people rely on your reasoning instead of relying on emotion. And we see that this simple message makes people more likely to intend to wear a face mask. While if we tell them to rely on emotions, they become less likely to wear a mask.
Right.
Yeah. But also in this case, we found no gender differences. So the effect is the same for men and for women. We wanted to find something specific for men, but so far we didn't manage to find anything. But we'll continue digging.
Well, didn't your research find that when masks were mandatory, the gender, difference disappeared, which I thought was probably the most important thing, right? So it comes back to the research on paternity leave, for example. Denmark, a bunch of different countries tried to do a bunch of different campaigns to be like, it's manly to take paternity leave, not really changing the needle. When they were like, if you don't take it, you lose it, right? The daddy leave, sort of famous law that was passed or policy that was proposed in Denmark that led to far more men taking paternity leave, was just saying that's what you got to do. That's what the norm is, right? You're setting a norm and you're setting a default, and then people have to default out of it. So I thought that was that was just fascinating. And, it more broadly, reinforced, I think, the trend that we're seeing, that in countries that were led by women, some countries that were led by women, Slovakia, New Zealand, right? Germany, we saw women in those countries put on face coverings very early, and set the norm that was, the way that we were going to do things. And that sets the norm for the entire, country, basically, and that they were able to eradicate the virus much more quickly. So it kind of points to the need, not just in our society and the social norms, but like, for that to trickle up or to trickle down from, having diverse leadership in countries and having women and men inside the room to set laws and policies and proof that women can be leaders too, and really good leaders, sometimes better leaders. So, in this particular, hellscape of a health pandemic, but in other, other emergencies too.
Absolutely, Liz. And you bring up a great point that we're getting a lot of audience questions about, which is solutions, right? We all want this pandemic to come to an end. Our audience is asking, what are some ways that we can change the stigmas around masks and encourage more people to wear them?
Valerio,
Okay, so as I said, we tried making people to rely on their reasoning, and the idea was to make less salient some negative emotions that might come out when thinking about wearing a mask. And as I said before, it worked, but it worked for both genders, which is good, of course, because there are also some women who don't wear the mask. So this worked, but of course it didn't work completely, and we would like to find something that works for men specifically, but didn't. We were not able to do this yet. And as Liz was saying, that's a very good point. Simply making mandatory to wear a face covering works. Also in our data, we found that in counties where wearing a face covering is mandatory, of course, everybody is more likely to intend to wear a face covering, but the more interesting thing is that gender differences almost disappeared. So making mandatory to wear a face covering affects men more than women, but only, and this is very interesting, I think, this works only for intentions, not for emotions. Men still think that wearing a face covering is not cool, is a sign of weakness, and is shameful, but they wear it because it's mandatory.
That's fascinating. Yeah, I mean, I have to, agree with everything that you just said. I think that it's like seatbelts. Like men at one point were, far less I think they still are less likely to wear seatbelts, but generally everyone wears a seatbelt. And we had the same debate, not the same, but like a very similar, some people were really mad when seatbelts became mandatory. But we just we're like, you wear a seatbelt. And it's like the thing you just do. When you get in your car, you wear your seatbelt. When you leave your house, you take your keys and you take your mask. That's it. That's just what we do now. And so to me, it just speaks to the incredible urgency of leadership in this country and in every other country around the globe, of leaders modeling good behavior and leaders modeling the very behavior that is absolutely necessary to combat this virus. And I can't, I could go on and on about how just gobsmacking it is to see the leader of this country go out without a mask and tell reporters not to wear masks and ask people who have come on a panel to speak to take off their masks, to hold rallies where people are not wearing masks. It's just I think the most irresponsible thing we can do right now, and that's the model, right? Like, this is the most powerful person in the world. This is the most powerful person in this country, and this is what they're doing. And so, I think the manly mask stuff, the G.I. Joe mask, sure, whatever, put whatever you want on it. I don't care. I wear a pink mask because I like pink. If you like blue and beers and baseball bats, wear that. That's cool. Express yourself. Just wear your dang mask. That's just pretty simple. That's just what we do now. I also saw, if I can share, I've seen some people. So I was walking down a park and there were two guys walking without masks. And I saw a guy actually run like kind of like come behind them and then run away and start screaming like, ah! Like basically like a horror, like, oh my God, like I'm so afraid of you. You're not wearing a mask. And then he just ran and like screamed. And I was like, oh, that's pretty funny. So I think people can like, you know, in their daily lives kind of use humor and different ways to reinforce this message. I mean, I will be honest, right now I'm experiencing COVID symptoms since Friday. And when I've had to go out, you know, I've been wearing a mask and I've been very, you know, careful, and I've not gone out mostly. But it's made me think differently. I'm like, wow, like if people, and there's a 2-person rule in the elevator in this building that I'm in, and I've seen people kind of just be like, whatever, come in. And I'm like, no, I have symptoms. Like, don't come in. And you know, we have to assume that every person has it, right? And like those things need to be drilled in, no matter what your gender is, so that we all can fight this.
Absolutely. Such a great point, Liz. And also, of course, we hope that you are okay and safe and healthy.
Yeah. Me too. I just can't taste anything. That's the worst part. I'm like, I love, you know, I'm having breakfast and I'm just like, I can't taste my peanut butter. So I'm excited. And if this is COVID, I'm very lucky. So I will keep you guys posted.
Thank you so much. Thank you. And thank you both for making time for this conversation during what I'm sure is a very busy and hectic time for everyone. So I'm very thankful that you were here. And for everyone, yeah, thank you so much. And for everyone watching, please follow QuickTake on all of your social platforms. And again, we just want to thank both of you for making time. You can follow Valerio Capraro and Liz Plank on Twitter at Feministabulous. And thank you both so much again for your time.
Thank you. Such an important conversation. So great meeting you, Valerio. I'm so starstruck.
Yeah,
and keep doing the great research you're doing. I'm excited to follow more of it.
Yeah, thanks.
Yeah.
Thank you both so much.
Bye.
Bye.